Hi everyone, welcome back. As promised, when I did the video of how massage can help bodybuilders, I am now in this video going to talk about common injuries in bodybuilders. I'm going to talk about how to avoid injury, what the types of injuries are, and then I'm going to look at the most common specific injuries that occur in bodybuilding and sort of how you can treat them and recognize them. Look, we all know there's nothing worse than getting injured, and especially just when you're starting to see some progress in your gym training. But if you pay attention to basic training principles, many of these injuries with a bit of common sense can be avoided. So I'm going to start by talking about basic principles to avoid injury. As I say, these are common sense, but they're often, relevant factors in people's injuries. So the first one is physical and mental status, before you're doing your training. Are you tired or preoccupied with stress? These are common issues that affect someone's focus, which results in poor form and injuries. Warm up, preparing the muscles and joints properly will increase blood flow, oxygen and nutrients to the tissues, and it also helps improve elasticity of the tissues. And this has a positive impact on how force is distributed through the muscle or joint. What I would say is, we talk about stretching a lot. And actually sometimes the type of stretches that you feel like you should be doing before a workout actually may not be the best thing if you're trying to increase strength and, prevent injury. So I would say definitely take a look at my video on which is a comparison of sports massage, stretching and foam rolling, which will go through different types of stretching, when you should be doing certain types of stretching and how that impacts, on the type of exercise that you're doing. Stretching obviously the muscles after a warm-up, not necessarily making the stretch itself your warm-up, can work better. Dependent on the exercises that you're going to incorporate into your workout, you may want to stretch to the end range of motion. Muscle balance and symmetry, when groups of muscles work together. So for example, the quads and the hamstrings, any weakness in one of these muscles can increase the risk of injury. And when weak points are identified, it's really important to focus training on those areas so that you can correct that imbalance as soon as possible. And again, sports massage can really help with this. Hunger and diet, a high protein diet helps to maintain strength of the muscle fibers and reduce recovery times. But if you're going into a training session hungry, this is going to increase fatigue and again reduce focus, and you're not going to perform quite so well, and you may well end up using poor form. So again, this will increase the risk of injury. And sufficient hydration as well. Even mild dehydration can really affect performance and increase the risk of injury. So do keep hydrated. Adequate air exchange, making sure that you really focus on your breathing, because exhalation during the positive movement and inhalation during the negative will really help you perform those movements to the best of your ability and help with, oxygenation of all your tissues. Shoes, it's surprising how many people, either runners or gym goers, are wearing, really old shoes that are loose around the ankle. They're not supporting the feet. Stiff-soled, comfortable shoes which protect the feet that should be replaced every 3 to 4 months if you're like running or something on a regular basis. So again, if you're in the gym and you're using a treadmill as part of your warm-up, this also will apply. Listen to your body is a really important one, because again, I said it in my last post about bodybuilders. They tend to have a type A personality, and sometimes there's this sort of competitive nature, and they will just push through injuries that should be getting rest. So listen to your body. If soreness exceeds the usual sort of DOMS type soreness, you may need to reevaluate your training and ensure that the muscles are sufficiently rested before your next training session. No pain, no gain is not always a good principle to live by. So, do listen to what your body's telling you, because, okay, in the short run, you may be out of the gym for a few days, but in the long run, it means that you're going to, be reducing that risk of injury, and you're not hopefully going to then be kept out of the gym, potentially for months, because you've ignored what your body's trying to tell you. Wrapping. Knee wraps during heavy squats can protect the knee joints by increasing the external pressure and distributing any impact across a larger area. And wrist wraps also may help during heavy deadlifting. So that's how you can sort of try to prevent injuries. Now we're going to look sort of at the different types of injury that are common in bodybuilding. So, strained muscles. I'm going to do a lot of videos on this topic. Overstretching or overuse of a muscle, where the muscle fibers are stretched beyond their limit, which then causes tears. It can happen through single traumatic events, or it can build up through repetition. Most strains will cause pain and spasms with movement, but in higher grade strains, the muscle is torn and causes swelling and limited movement. And certainly on those big muscles such as the quads and hamstrings, you're really going to know straight away if you've sort of got a grade 3 tear, because you're going to get real severe bruising, and it's going to be extremely painful. Sprained or torn ligaments. Again, so overstretching of a ligament is often accompanied by damage to the joint capsule, tendons, or muscles. And it can be more complicated than a muscle strain, resulting in swelling, bruising, and more commonly than with muscles, loss of function. So this really, requires rest. Tendinitis, where you get inflammation of a tendon, usually due to a muscle imbalance or repetitive movements. So something like tennis elbow, where the wrist flexors are stronger than the extensors, and then you're getting that pain on the outer edge of the elbow. And bursitis, which is inflammation of those bursa sacs, those fluid-filled sacs that cushion the joints, between, where you've got the muscle and bone. Usually this occurs due to an unequal force within the joint, linked to either a muscle imbalance or repetitive movements. So muscle imbalance will pretty much always alter the normal mechanics, and then, causes irritation of the bursa. Now, then you've got hernias and intervertebral disc herniation. So these are usually caused by poor breathing technique. overexerting yourself, when you're lifting heavy weights with inadequate breathing techniques causes an increased internal pressure. And then herniation of that lower abdominal wall, the spinal column, and also in the groin can occur. Now, in the case of intervertebral herniation, the nerves can be affected by disc material leaking into the spinal canal. This will cause radiating pain, numbness, tingling, weakness, and just sort of altered skin sensations. Altered mechanics really should be addressed before the condition can cause permanent degeneration of those discs. Other types of injury could be avulsions, which is complete tearing of a muscle. Typically happens along the junction of the muscle and the tendon. And avulsion fractures, which happen when a piece of bone is pulled away, usually due to increased force on the ligament or tendon. Contusions, which is bruising caused by an impact. Fractures, which obviously breakage of a bone, can be complete, partial, or from compression. Accelerated wear and tear, or arthritis. So these are all your types of injuries. Okay, so I'm now going to talk about those more specific common injuries that occur with bodybuilding. So first off, neck strain, due to excessive strain being placed on the neck muscles when you're lifting heavy weight. And pectoral tears as well, so tearing this muscle that's coming in across the chest. The tendon that connects the pectoralis major to the humerus, so it comes across here, is torn, and that can cause anything from minimal to extensive bruising. In severe tears, the muscle will then bunch up towards the sternum, so it can be quite noticeable when you've done that. And this particular pectoral tear is particularly common in those that use anabolic steroids. So, there are so many reasons why you shouldn't use anabolic steroids, health reasons as well, and this is just one of them. So, okay, so another common injury is elbow tendonitis. Now this can happen commonly in 3 places. So you've got triceps tendonitis, so that's where overuse causes pain in the tendon coming off the triceps muscle. So it's around the pointed area of the elbow. Then you've got lateral epicondylitis or tennis elbow, which is where the forearm extensor muscles are strained, and that causes pain on the outer edge of the elbow. And then you've got medial epicondylitis, otherwise known as golfer's elbow, and so that's overuse of the wrist flexors, which causes pain on that inner bone of the elbow. Okay, so then another common injury is back strain. No surprises there really. If you're lifting heavy weights, central pain in the lower back and across the top of the gluteal muscles, or along those erector spinae muscles that run down vertically either side of the spinal column, that's where you're usually going to feel it. And it usually occurs really due to excessive stress being placed on the muscles by lifting too much weight, or sometimes through poor form, maybe with squats or deadlifts. So this is where I always say, increase your weight gradually, and do ensure, right when you first start out at a gym, do ensure that you're using proper technique. And this is where your consultation with a personal trainer comes in. Knee strain or sprain. So this encompasses a wide range of injuries, including meniscal tears, which I will do a video on in the future, patella tendonitis, ACL tears, bursitis, and pain may follow the joint line of the knee, the posterior knee, or be under the kneecap. So there's quite a range of symptoms that can occur. Right, then you've got your DOMS, your delayed onset muscle soreness. So this is your soreness that arises 24 to 48 hours after working out, and it really just happens due to accumulated cortisol and lactic acid in the muscle. Sometimes it may be that there are also some micro tears in the muscle, but sports massage can really help with this. So really, for any of these injuries, there may be specific treatments, but there's also a sort of a standard treatment plan, which is your RICE. So rest, ice, compression, and elevation. And this will just help promote recovery by reducing inflammation, internal blood loss, and scar tissue formation. Okay, and as we know, scar tissue formation can really, if that sort of really builds up, that can really increase your chance of an injury in the future. Also, avoid any exercises that worsen the symptoms. Again, no pain, no gain is not always a great principle to live by. So listen to what your body's telling you. Now, this is generalized, as I say, and dependent on the grade of injury and individual recovery, but these are just basic guidelines, for you to, try and deal with any injuries that come up. So with muscle strains, you're looking to rest the area for certainly 1 to 2 days to promote healing. After 2 days, begin to perform basic range of motion exercises. And then once pain-free, then you can slowly start to resume muscle loading, gradually increasing the intensity until full function is re-established. But as I say, for a grade 3 muscle tear, for example, of your quad, that's going to take a lot longer to resolve, and you're going to be in pain for a lot longer. So this is a general, recommendation. Ligament sprains. So sprains heal over a longer period of time than muscle strains because the joints don't have the same blood supply as a muscle does. So stretching of the connective tissue can also cause chronic joint instability without sufficient rehabilitation. So again, RICE, your rest, ice, compression, and elevation is really important. And then after 48 hours, you can slowly start to work through the range of motion, despite movement being limited, in order to increase the circulation and again avoid that excessive scar tissue formation building up, which can then, increase your risk of injury in the future. You want to weight bear as soon as possible, but only do as much as the pain or swelling allows. If the connective tissue is damaged, try to strengthen the surrounding muscles to help stabilize the joint. Ligaments, can take over a year to return to their normal length. And anyone who's had an ACL, tear or complete rupture will know, that the recovery on these injuries can be slow. So patience is key. Tendonitis. Again, your ice, rest, ice, compression, elevation. Focus your rehabilitation on strengthening the muscle, particularly in eccentric contraction. And your personal trainer or a sports therapist can give you information about this. And anti-inflammatories, just to help bring that inflammation down. And once the inflammation and the pain have resolved a little bit, you can then look at possibly sports massage to help with, the surrounding muscles and stabilising the joint. And bursitis, really, the treatment is pretty much the same as tendinitis, really. But the rehabilitation should include joint motion and muscle balance. So that is your common injuries in bodybuilding. And then little sort of basic guidelines on, sort of standard treatment. As I say, for specific injuries, there will be some specific treatment options as well. And I will, as I say, be doing more videos on specific injuries and specific muscle groups. So do keep your eye out for those. You can subscribe to my channel and you'll be informed when those come out. Yeah, feel free to comment down below. Contact me through my Facebook or Instagram, and I will do my best to answer any questions that you might have. But for now, that is it from me. So, stay safe in the gym, work out safely, and do all those things that we've mentioned there to help you avoid injury. But that's all from me. So for now, it's goodbye, and I'll see you next time.